What scientists have noted is that there is a community transmission of monkeypox, i.e. there is an increased number of cases among gay, bisexual men and men who have sex with men, also known as the MSM. This has led to the question of whether monkeypox is a sexually transmitted disease similar to HIV. I mean, at this present time, you can say that monkeypox is not specifically a sexually transmitted disease, but you can also say that yes, monkeypox can be sexually transmitted, as the evidence and the numbers speak for itself. But what has not been highlighted is that the majority of these cases are actually in this community of gay, bisexual men and men who have sex with men. Also, initially it was thought that maybe the monkeypox was kind of confined to this group of people in one setting, but it has been found that monkeypox has been found in different parts of the country, which means that it's not confined to one sexual network or community, but different communities. So the question is, how is this happening? How is this being sexually transmitted? Initially, we were getting the numbers in terms of, okay, 6 out of the 9 when the first cases came about were from the gay and bisexual community, but now they've stopped giving figures and they now use the word predominantly amongst the gay, bisexual and men who have sex with men community. I'm not sure why they've stopped giving the figures, but there could be several reasons for that. Now, this has far-reaching implications because we know that from what I've told you about the transmission, sexual intercourse or sexually transmitted route was never previously mentioned as a way of catching monkeypox. It was more bodily fluids like, saliva, urine, feces, but no one has really ever mentioned sex as a way of catching monkeypox. And this is interesting because we know that in some parts of the world, especially in parts of Africa, some humans actually practice bestiality with animals. Now, if you don't know what bestiality means, you better go and look that up. But that is a disgusting act. So is it possible that some humans in Africa could have caught monkeypox through practicing bestiality with animals, apart from just the usual contact or indirect contacts that they would have with infected animals that were non-sexual? The question that is puzzling scientists at present is why is it specifically the gay community that tends to have the most predominant cases? But they're also cautious that monkeypox is not labelled as a gay disease similar to HIV, as this can lead to stigmatization and can prevent people from coming forward due to fear of being labelled. However, the irony is that while the government is trying to avoid stigmatization, they're also now offering smallpox vaccines to the gay community. There are also concerns that sexual health clinics will become overrun with people panicking and wanting to be checked out or tested that they might have the monkeypox virus. So they've advised, look, we're happy to listen to you if you're worried about having the monkeypox, and we're happy to do tracing, but if you have the monkeypox virus, they've been advised to isolate for at least 21 days. They've also been told what symptoms to look out for in terms of the fever, headaches, muscle aches, swollen lymph glands, as well as in particular the rash, which can be quite similar to the rash of chickenpox. And they've said also look out for the rash in your genital area. Initially, monkeypox is thought to be common in the face and the hands, and can also spread to other parts of the body. But you've also been told, look out for monkeypox virus or the rash in your genital areas. And that could be a sign that it's sexually transmitted. So, can monkeypox be sexually transmitted? Yes. Is monkeypox a sexually transmitted disease? No. Because before all this, monkeypox has already been identified way before it was shown that you can actually catch monkeypox through sexual intercourse. However, it is something to become aware about.